So thank you very much for having me here today. It's great to see lots of people in the room. So I'm clicking ahead of myself here. My name is Meryl Jones. I work for the Marta Refugee Health Service in Brisbane, and I'm also a member of the Executive of Refugee Nurses of Australia, which I'll talk a little bit more about the organisation in a minute. I should actually acknowledge that these slides and this presentation was actually put together by Bronwyn Blake, who works for the New South Wales Refugee Health Service, and the majority of the work that has gone into developing these standards of practice has been done by Bronwyn with her colleague Sandy Eager, also from the New South Wales Refugee Health Service, and also Leanne Schmidt from the Metro South Refugee Health Service in Logan in Queensland. So refugee health nursing is not currently a specialty area, but it is a developing body of knowledge and expertise amongst registered nurses, most of whom work in primary care settings. So we know there are around 120 nurses across Australia who work specifically with patients of refugee background, but every nurse in Australia has probably had contact with patients of refugee background at some point in their career. So if we consider the model of healthcare in Australia, general practice really is the core of that. So practice nurses play a really significant role in the care of refugees. So just some quick definitions. Is there anybody, and no shame at all here, is there anybody in the room who doesn't currently understand or know what the distinction is between a refugee and an asylum seeker? Okay, so very, very quickly, refugee and sort of immigration 101. So I am from an ethnic minority and I live in country A in the north of the country. War breaks out in the country, in the north, and as member of a persecuted ethnic minority, I flee to the south of the country. At this point, I'm an internally displaced person. The war then comes down to the south as well, and I flee over the border into country B, where I lodge a claim for protection. At that point, I'm an asylum seeker. When my claim is for protection on the grounds of persecution because of my ethnic minority status, so when that claim is heard and it's determined under the UNHCR convention that you can see up there that I am or I do have a legitimate claim, at that point I become a refugee. So the distinction between asylum seeker and refugee is a legal distinction, but everybody who is a refugee has actually been an asylum seeker at some stage, so it's all part of the same journey. So often we talk about people being of refugee background because it encompasses all of that journey.
Can I just ask where does the immigration detainee fall into this?
They are both currently. So the people who are assume, obviously, the most well-known cohort of these people currently in Australia are on Manus and Nauru, and there are both within that because some of them have had their claims heard and some of them have had their refugee status confirmed. Others, I believe, have not actually gone through that process yet, but have lodged a claim for protection, so they are still asylum seekers at this stage. So most importantly, I think for you to know in your day-to-day work why that distinction is important is that asylum seekers may or may not have access to Medicare, whereas everybody arriving into Australia on a refugee visa has full access to Medicare. So just to give you an idea of the global figures, we know that the number of people displaced by war and conflict across the world are increasing. So the UNHCR estimates that around 68.5 million people currently are displaced, of whom 25.4 million, again, have had their claims assessed and have been found to be refugees and will be waiting, the majority of those will be awaiting resettlement somewhere. So Australia has a well-recognised humanitarian settlement program. It's a really, really good one. And our numbers have increased over the last couple of years, the numbers that we take, but obviously we're now taking around 18,750 people on the humanitarian program this year, which is great, but it's a drop in the ocean compared to 25 million. So when refugees arrive in Australia, the refugee journey plays a really significant impact on their current health. So just listed here are some really obvious impacts of how war can affect your health either directly or indirectly. And once you have, fled the war and you're in another place, maybe a refugee camp, and this is a fairly sort of typical example of what a refugee camp might look like. So you can see there's problems around potentially overcrowding, fire hazards, fairly unsanitary conditions. And when you think about, particularly for children, the lack of access to play, disrupted family life can really have quite a significant impact on child development as well. And the uncertainty of, certainly of asylum seeker status, has a really significant impact on mental health as well. But once people arrive, and even though Australia does have a really great resettlement program, life still is difficult and includes, but isn't limited to, social issues like those on the right, and also health issues like those you can see there listed on the left. So there had been some discussions amongst the lead refugee health nurses in each state and territory across Australia about the need for some kind of space for us to exchange information and resources. So in 2016, there was a meeting where some of these ideas were nutted out. And RNA, as we call ourselves, Refugee Nurses of Australia, was launched in October in 2016. And we do have members now in all states and territories across Australia. And so our aim is really to provide a professional platform for nurses working in the field of refugee health, and also for any other nurses whose work may involve refugees and people of refugee background. So in Queensland, we have nurse navigators, which some of you may have heard of. So we have the multicultural nurse navigators from around the Brisbane South region who are part of Refugee Nurses of Australia. Elsewhere, there are sexual health nurses, and many other nurses working in primary care roles who are also members because their work brings them into contact with people of refugee background. So in 2017, we held our very first forum in New South Wales, and we actually held workshops where attendees took part in one of 7 focus groups where we got them to brainstorm what it really means to be a refugee health nurse and what the role involves in our different services across Australia, because every single service has its own model of care. So the work we do does change slightly from area to area. So what we wanted to do was work out what are the common things, what is it that we do that is slightly different from other nurses working in primary care settings. And we were very fortunate that Professor Elizabeth Halcombe came to actually chair that session for us and also contributed to developing the scope of practice. So, as I'm sure you're all aware, the Nursing and Midwifery Board of Australia developed the standards of practice for registered nurses. So what we needed to do in order to do this work was to identify what refugee health nurses do beyond these standards of practice so that we don't actually restate what is already out there. So the standards of practice that we've come up with go beyond this framework, and they concentrate on what we do, which is specific to refugee health nurses in a specialised service. So this is our vision statement that we created that defines who we are and what we do. I think really just to sort of underline this idea of trauma-informed care, which if you're not familiar with, don't really have time to discuss here, but by all means come and talk to me about later. And also, I think also just to highlight that this is a very politically charged space in which we work, and there's no getting away from that really. So after much consultation, and there were many drafts made, we actually developed these 7 standards, and I'll talk more about each one in detail now. So first of all, we recognise the value of continuous education and professional reflection. We recognise and understand and respond to the dynamic political environment that refugee health is embedded in. And we also acknowledge the risk of vicarious trauma to ourselves and within our workforce. And we actively engage with the relevant system support, which includes peer and clinical supervision, because we want to protect our workforce, and we don't want to, if there's only 120 of us in the country, then we don't want people to get burnt out. We also work within all the sort of relevant local, state and national policies and guidelines and protocols. So, things that apply to everybody else as well, like workplace health and safety and infection control and child protection. So communication is key to any nursing role, obviously. So Within our refugee health nursing context, though, we also understand the past political contexts and current global effects that trigger people to seek safety outside of their country of origin. So we're very aware of the trauma that affects our clients both pre and post-migration, and the settlement stress that can occur once people are safe in this country. And we support and educate our clients in accessing the Australian health system. So health literacy is something that's been discussed very frequently at the conference in the last day or so, which is great, and it's obviously a really, really key thing for many of our clients. So obviously providing culturally safe and contextually informed care is a really key part of what we do. So we perform comprehensive health assessments. Some of you may be aware that there is actually a specific item number which can be claimed for new humanitarian entrants within their first 12 months of Australia, and that's really to help them settle in the country. So by identifying, any risks to their health caused by the migration journey or any health problems that they have on arrival in the country, we can help to sort of keep them healthy and enable them to settle well into life in Australia and become sort of valued and productive members of our society. So our health assessments include psychosocial, physical, mental, and I've actually included oral health separately because I don't know about you, I do remember doing a tiny bit of oral health in my training, but not a huge amount, and actually it's something that I do pretty much every day in my practice now. So obviously we use culturally appropriate as well as evidence-based tools and guidelines and communication. Immunisation is another really key part of the refugee health nurse role as well. So we spend a lot of time evaluating people's immunisation history, looking at documents from overseas, making sure that vaccinations given overseas are recorded on the Australian Immunisation Register, and also developing catch-up schedules for people once they've arrived. And hopefully, if we're still in touch with them a few years later and it's time for them to go and visit family overseas, then we can actually provide them with travel advice around vaccination, prep, all those kinds of things as well. So I've touched a bit on what the comprehensive nursing assessment includes. So it's really important for our nurses to be knowledgeable of both mainstream services and specialised refugee health services, like torture and trauma services, to facilitate optimal health outcomes. And the specialised services vary very much from state to state and territory to territory. So commonly, there will be infectious diseases, paediatric and mental health, specific sort of refugee-focused services in the majority of different areas. The service in which I work, I'm really lucky, we also have a cardiovascular clinic which specialises in seeing refugees as well, but there will be different ones in each place, so you really need to know your local area. So we understand personal health beliefs and behaviours and biases, so that we can appreciate the cultural expectations of others and facilitate healthcare delivery, promotion and prevention. So if you're not already familiar or haven't heard of Kleinman's explanatory model, it's a really great way to elicit your client's health beliefs around what they think is going on with their health and what it means for them. So again, I don't have time to discuss it here, but it's always worth using because you get some really, really interesting answers back. We also advocate for the development and translation of resources required, and also introduce most of our clients for the first time to the concept of preventative healthcare, because even in countries with previously well-developed health systems like Iraq and Syria, prior to the conflicts there, had really good health systems, but preventative healthcare, GPs didn't really exist there. If you wanted a specialist, you didn't get referred by a GP, you just went to the hospital and sat outside the specialist's door until they saw you. So we adhere to a very strict policy of interpreter use as a right for effective communication, and I would say to all of you that if you are not using interpreters with people who don't speak English, then you are actually failing to protect your clients' human rights, and you are also not complying with your medico-legal responsibilities. We also, as a group, need to be aware of vicarious trauma to our interpreters, because they actually come from the communities that they are interpreting for. So while it might be difficult for me to hear a harrowing story of something that somebody from Congo has been through, for that interpreter, they may actually be reliving that. So we really need to protect our interpreting workforce and work closely with them as well. And our final standard. We advocate for equitable access and self-determination. So we really need to recognise what those access issues are for refugees and actively work to empower people and to overcome those barriers. We also are quite a proselytising group, and we really want everybody to participate and be skilled up in this area. So we're very keen to provide opportunities to the undergraduate and postgraduate workforce for clinical placements. And this is what's next for us. So we had our second national forum actually just last week, which was a great success. We had about 50 nurses from across the country come to Brisbane. And thank you very much for having me.